Good morning. My name is Aaron. I'll be your student nurse today. Before we start off, can I check your ID band to see if you're the right patient? And what's your name and date of birth?
Mary Jones, December 1st, 1950.
Okay, perfect. Now I am gonna go ahead and put some gloves on. And I'm gonna raise the bed to working level. Alright, Mary Jones, are you allergic to any latex or iodine?
Just iodine.
Just iodine. Okay, so in the procedure we're gonna go ahead and insert Foley catheter to help with your urinary retention. So now that you've told me that you are allergic to iodine, we will go ahead and remove that stuff from the process. I'm gonna go ahead and perform perineal care before we start. Are you okay with that? Would you like us to perform perineal care?
Yes.
Perfect. Okay, I'm gonna put this bath towel here for privacy. Actually, put this back in. Alright.
Oh my gosh.
Go ahead and Alright, and then we're gonna go ahead and put the patient in the frog-like position.
A little bit bigger, slightly bigger.
He's thin, but he's tall.
Okay, I do have my washcloth and my basin here. My drying towel, and my bucket full of water. Okay, so we're gonna go ahead and put you down now. I'm gonna grab my clean water tub.
I probably do know what you're talking about, but.
Yeah, no, I was looking at
I know.
And the computer wasn't working, and he called the IT guy, and he's like, you gotta come fix this girl's computer right now.
Starting from the side farthest to me to the side close to me, and then doing it in the middle. Okay, switching sides of the towel every time. Okay, now I'm gonna go ahead and pat dry. Okay. Prior to the perineal care, I would have applied a chucks to help with any water that would have been spilled in the process. Okay. And then I would have went ahead and cleaned. But now that the process is done, I'm gonna go ahead and remove this out of my way. Okay. Then I would go ahead and remove my gloves. And then I'm gonna go ahead from hand hygiene. Now I'm gonna go ahead and start the procedure. So I'm gonna get my urinary catheter up.
You know when you're under oath, after you put on your gloves, you don't have to open this like going around.
Trying to maintain sterility.
You're already sterile.
Alright, what were the things that? Okay, after.
Very clear before and after, and then.
Okay, now I'm gonna go ahead from hand hygiene, and I'm gonna go ahead and put my sterile gloves on.
And clean up.
Put it in the garbage.
We want to repeat these if you don't, right?
Yeah.
Well, I guarantee you there'll be like hundreds of different.
Okay.
Hopefully you don't have to stop me, but like maybe one time. I'm definitely gonna forget something that we wanted to then. Hello. Hello, Mr.
Okay, if at any contact I did touch something that was contaminated with my gloves, I would go ahead and change my gloves. But now that I have sterile gloves on, I'm gonna go ahead and get my drape up. With the silver lining on the bottom.
Insert first half into a male. So first thing I do is I'm gonna take the shirt to make sure we're in the right patient and it's supposed to do. And also before I walk in, I'm gonna check to see that safety precautions are on.
That's it. Then I'm gonna go ahead. I'm gonna add my blue drape to add more, to expand my sterile field.
It's kind of a fast procedure. It's a little bit uncomfortable, but it's helped with your urinary confidence to help you urinate. It should lose some pressure.
Okay. Then I wouldn't need my fenestrator, so I would go ahead and toss that.
I'm going to,
Now, Ms. Mary, you did say that you are allergic to iodine, correct?
Yes.
Yes. Okay, so we'll be using a hydrogen peroxide, so I would throw that out as well. So, I'm gonna go ahead. I'm gonna go ahead and prep my cotton swabs with the hydrogen peroxide, and then I'm gonna go ahead and open my jelly and place that as well for my catheter, and then toss that. Now that that's done, I am going to take my port, and I'm gonna go ahead and put my syringe in there.
Alright, so we're gonna get ready to
Throw
wash
that
you up.
in the garbage. Place this. Okay. Once that's settled, I'm gonna go ahead and remove this.
So I do have to expose you the material, okay?
Okay.
Sorry.
Then I will throw this away as well. Then after here, I'm gonna go ahead and apply apply the lubricant 5 to 7. I'm sorry, 2 to 3 centimeters. Now that that's done, I'm gonna go ahead and swab the hydrogen peroxide cotton balls. Alright, Ms. Mary, I'm gonna go ahead and clean your perineum.
So I'm gonna grab my chuck.
Somebody had to redo that, so they.
Okay, and then I would go ahead and dispose of this in the sharps container.
Alright, Mr. Jones, I'm gonna begin washing you up, okay? Nice, warm, soapy water.
Now we have a catheter. Alright, Ms. Mary, we're gonna go ahead and insert the catheter. So I'm gonna have you take a deep breath as I insert. So once I insert, I would go ahead and put it in 2 to 3 inches. And then once I see urine, I would go another 2 to 3 inches. Okay. And I would go ahead and hold that there as I inflate my balloon.
Okay. Now I'm done cleaning you up. I'm going to rinse you out.
Once my balloon is inflated, I'm gonna go ahead and dispose of this. This would also go in the sharps container. Once that's done, I'm gonna go ahead and pull to make sure that it's actually in there. Okay. Now that I see that it is actually in there, I'm gonna grab my brace. I'm going to go ahead and
I'm done cleaning you up. Gloves off. Hygiene. Alright, so now I'm gonna get ready. I set up a sterile field. Just make sure you don't move around too much. Just utilize just where they're at.
okay. And I'm gonna go ahead and iron this with the blocks. Okay. Then I want to grab my bag and put it under a position where, on the bed where the bed is movable. And I'm gonna check for the patency of the bag to make sure it's closed. So I verify that it's closed. I would go ahead and
Alright, so in this situation, I
Ask-
did call.
and alright, Mrs. Jones, we're all done. I'm gonna go ahead and dispose of this. Would you like me to perform any perineal care?
No.
No? Alright, Mrs.
Now I
Jones.
have my sterile gloves.
I will dispose of this. Then I will go ahead and put the position back in place. Put the gown back down. Take the bed bath off. And since the patient has said that they didn't want any perineal care, we won't be doing that today. So for the purpose of the video, I'm gonna keep the bed back up and the position like this to remove it. But essentially, if I was to come back in, I would go ahead and assess the patient again with new gloves. Take these off. So, Ms. Jones, I'm gonna go ahead and I'm gonna be removing your catheter because I have seen that you don't need it anymore. So, I would put new gloves on. Okay, once I have my gloves on, I'm gonna go ahead and grab a chuck for the floor. And I'm gonna go ahead and use my container, my cylinder, and I'm gonna let the urine out and check for the order, the amount, the order, and the consistency. We're looking for a slight order or orderless fluid. And then according to whatever fluids it was taking, we're looking for those colors and no cloudiness, very clear. So then I would go ahead and dispose of all this where it belongs. And then once we're ready to remove it, we'll go ahead and tell the patient we're gonna go ahead and start removing your catheter, Mrs. Jones. So I would have my syringe. I would have a new syringe, and I would place the chucks. But since that one's already there, I'm gonna leave it there. Okay, so I would go ahead and take this, once it's empty, take this off. Place this there, and then I would go ahead and undo this. Take the leg strap off. Okay, then I'm gonna go ahead and the gravity suction the water from the balloon off. You doing okay, Mrs. Jones?
Yeah.
All right. And once I have the same amount of fluid that I had inserted in the first time, which could be found in my documentation, I would go ahead and remove the syringe. And then slowly, I'd tell the, okay, Mrs. Jones, we're gonna go ahead and pull out the catheter. Can I even take a deep breath for me?
Yep, okay.
Okay. Once I have this, I would go ahead and dispose of this in the biohazardous container. And then, Mrs. Jones, would you like us to perform any perineal care?
No.
No? Perfect. I would put the patient back in its intended position, her intended position. Put her gown back down. And set the bed back down. This bed's having technical difficulties, and I'm gonna go ahead and remove my gloves and perform hand hygiene.